Welcome to The Explainer. Today we're tackling a super common medical issue that a lot of people have heard of but maybe don't fully get: the hernia. What is it, really? And more importantly, when does it go from being just a nuisance to something genuinely dangerous?
All right, let's get right into it. Here's what we're going to cover. First, what exactly is a hernia? Then, we'll look at the two big families they fall into. We'll do a quick tour of groin hernias, then check out the others, and we'll wrap up with the most important part: when a hernia becomes a real emergency.
Okay, first things first. Before we start talking about all the different kinds of hernias out there, let's just build a really simple, solid understanding of what we're even talking about.
So at its heart, a hernia is basically a containment failure. The analogy of an inner tube poking through a weak spot in a tire is perfect. You've got some organ or tissue, maybe part of your intestine, that's pushing through a hole or a weak spot in the muscle wall that's supposed to be holding it all in. Simple as that.
Now, this is super important. Hernias can basically be in one of two states. The first is reducible. That just means you can gently push the bulge back into place. Usually, that's okay. But if it gets stuck out and you can't push it back in, that's called irreducible or incarcerated. And that is a huge warning sign. It's the first step on a very slippery slope to a real emergency.
Okay, so we know what a hernia is. Now, how do doctors categorize them? Well, it pretty much all comes down to one simple thing: location, location, location.
And wow, the numbers are pretty lopsided. A whopping 75%, 3/4 of all abdominal wall hernias happen down in the groin. The other 25%, we call those ventral hernias, which is just a fancy way of saying they pop up somewhere else on the front of your belly.
So, since they're the big kahuna making up most of the cases, let's start our tour with groin hernias.
And to give you an idea of just how common we're talking, get this: 1 in 4 men will develop the main type of groin hernia, an inguinal hernia, in their lifetime. That is just a staggering number. It's incredibly common. Okay, so even within that one category, you've got two main flavors. You have indirect hernias. These are usually congenital, meaning you're born with the potential for one. They follow a natural tunnel and can sometimes go all the way down into the scrotum. Then you have direct hernias. These are the ones you get over time from wear and tear. They just punch straight through a weak spot in the muscle wall, and they usually don't travel as far.
But wait, there's another player in the groin hernia game. It's way less common, but this is the one you really need to know about. This is where the risk factor just goes through the roof. I'm talking about the femoral hernia.
And here's the number that should stick in your head: 10 times. A femoral hernia is 10 times more likely to get into serious trouble. So why? Well, it's all about the anatomy. It has to squeeze through this really narrow, really rigid little opening. And because that hole doesn't give, it's way, way easier for whatever pokes through to get trapped and have its blood supply choked off. That's called strangulation, and it's a huge deal. That's why doctors take these so seriously.
All right, that's the big 75%. Now let's shift gears and look at that other 25%, the whole world of ventral hernias.
So here's a quick rundown of the common ones. You've got epigastric hernias, which are up high on the abdomen and are often just a little bit of fat poking through. Then there's the umbilical hernia, right at the belly button, super common in infants, but in adults it's usually from increased pressure. And then there's the incisional hernia, which, as the name suggests, pops up at the site of an old surgery scar. And here's a weird twist: for these, a smaller defect can actually be more dangerous than a big one.
Okay, time to bust a common myth. This is something you hear about a lot, especially with new moms or folks carrying extra weight around the middle. It's called diastasis recti. Is it a hernia?
The answer is a hard no. It's not a real hernia. Sure, it can cause a bulge, especially when you do a sit-up. But the reason it's different is that the underlying connective tissue, that tough fascial layer, is stretched, but it's not torn. There's no actual hole for anything to push through. So, not a hernia.
All right, here's another one you've definitely heard, probably yelled by a sportscaster: the sports hernia. So, is it what it sounds like?
Nope, this one's a total misnomer. A sports hernia has pretty much nothing to do with an actual hernia. It's a completely different kind of injury. It's a strain or a tear of the muscles and tendons down in the groin area. It hurts, for sure, but it's not a hernia.
Okay, this brings us to what is, without a doubt, the most important part of this whole explainer. We need to talk about when a hernia stops being just an annoyance and turns into a real, legitimate danger.
The path to danger is actually a pretty clear 3-step ladder.
Step 1, it's reducible. You can push it in. Generally safe. Step 2, it becomes incarcerated. Now it's trapped. This is your big, blaring warning sign. And then there's Step 3, strangulated. This is when the blood supply to that trapped tissue gets cut off. And folks, this is a code red, full-blown medical emergency. And this right here is exactly why it's so serious. Necrosis, that just means tissue death. Perforation means a hole develops. So if a piece of your intestine is trapped, dies, and then bursts, you can imagine that is an absolute catastrophe inside your body. It's why there's no waiting around. Surgery has to happen, and it has to happen now.
So, what are the red flags you need to watch for? Well, here they are. If you have a hernia and all of a sudden you're hit with severe pain, you feel sick, you're vomiting, or you can't pass gas, it's go time. And if that bulge itself gets firm or tender or worse, changes color, like it looks red or even purplish, that is your signal to stop what you're doing and get to an emergency room. Period.
All right, that was a lot of information. So what's the big takeaway here? What's the one thing you absolutely need to remember from all this?
It's this. A hernia is so much more than just a bulge. As we've seen, where it is, what kind it is, and whether it's stuck or not, all of that determines the risk. All bulges are not created equal. And that's exactly why you can't just Google it. You have to get a proper diagnosis from a doctor.
And that leaves us with one final thought to chew on. You know, it's really easy to ignore a small, painless bulge and just think, it's nothing. But the real takeaway here isn't just about knowing what it is today. It's about understanding what it could become tomorrow. It's about spotting that potential risk before it has a chance to turn into a full-blown crisis.